Hello, my name is Co Mai Duong. I am a Pharmacist Candidate of 2022 from California North State University, College of Pharmacy. Today, I am going to talk about medication named Fluoxetine, brand name is Prozac. Some consultation point for Prozac. It is the medication to treat conditions associated with mood, such as depression, obsessive compulsive disorder, panic attack. Sometimes it is used together with olanzapine to treat panic depression caused by bipolar disorder. Take fluoxetine in the morning. If you feel tired, please take at night. The most common side effects include constipation, diarrhea, upset stomach, throw up or feeling less hungry, dry mouth, feeling sleepy, strange or odd dreams, trouble sleeping or feeling tired or weak. Keep taking this drug as you have been told by your doctor, even though you feel well. What sign and symptom that you need to call your doctor right away? Sign of allergic reaction such as rash, hive, red or swelling of the skin, sign of low sodium such as headache, trouble focusing, memory problem, seizure, or the change of balance, a big weight loss or gain, seizure, as I mentioned, dizziness, slow heartbeat, or any unexplained bruising or bleeding. Indication of fluoxetine includes bipolar depression, bulimia nervosa, major depression disorder or MDD, obsessive compulsive disorder or OCD, panic disorder, premenstrual euphoric disorder with the brand name Seraphim only. Prozac is a medication approved to use in children of the age of 8 with depression and the age of 7 for OCD. The mechanism of Prozac is it belongs to SSRI class or serotonin reuptake inhibitor, which inhibit the serotonin reuptake, which make increase the serotonin level. Minimal or no effect on reuptake of norepinephrine or dopamine. Some pros and cons of fluoxetine. Pros to treat the depression in children that age from 8 or obsessive compulsive in adult and children from the age of 7. Treatment of eating disorder, as I mentioned before, it's less likely to cause a weight gain or sedation. The generic is available, rarely cause seizure. For the cons, it's increased risk of bleeding, especially you with other drugs that increase risk of bleeding. May increase risk of suicidal thoughts or behavior, especially with young adults, as other antidepressant medication. Interaction or overdose may cause serotonin syndrome. Speaking of interaction, fluoxetine interact with monoamine oxidase inhibitor or MAOIs. The MAOI should be discontinued at least 14 days before initiating fluoxetine. If on fluoxetine, discontinue fluoxetine at least 5 weeks before taking MAOIs due to its long half-life which is from 4 to 6 days. Fluoxetine is the CYP2D6 substrate and strong CYP2D6 inhibitor, so the dose would be adjusted there. Dosing and administration strength of the tablet and capsule range from 10, 20 to 40. The Prozac weekly is strength is 90 milligram. The liquid strength available is 20 milligram per 5 ml. Administration or the product take with or without food. Long-acting product need to be swallowed in whole. Do not chew, break, or crush. The liquid solution measure dose carefully. Please use the measuring device or that come with the drugs. Side effects. Some GI problems such as nausea, vomiting, dry mouth, upset stomach, throw up or feeling hungry, feeling sleepy, strain or odd dreams, trouble sleeping, feeling tired, hot flashes, feeling nervous or excitable, shakiness, sweating a lot, or headache, nose or throat irritation, flu-like symptom. Some warning and precaution. Depression, you need to contact your doctor immediately if you experience any of the following serotonin syndrome that I mentioned before. The signs symptoms such as rapid heart rate, high blood pressure, dilated pupil, heavy sweating, suicidal thought or behavior, QT prolongation, disease-related concern that when you're taking fluoxetine, such as cardiovascular disease, hepatic impairment, renal impairment, and seizure disorder. Monitor parameter for safety, EKG, or measure the QT interval in patient with cardiac disease. Electrolyte such as sodium, potassium, magnesium, blood glucose with the diabetic patient, renal and liver function. Monitor magnesium in elderly who taking diuretic or PPI. Sign and symptom of serotonin syndrome. For efficacy, assess the mental status for depression, sign of clinical worsening, suicidal ideation, anxiety, social functioning, mania, panic attack, sign and symptom of suicidal behavior, or the GI symptom, nausea, vomiting, diarrhea. For dose adjustment, no need dose adjustment for renal impairment. However, for hepatic impairment, use the lower dose or less frequency in those chronic liver disease patients. And here is my reference.